Welcome, medicos. Let's begin with this quote. If you want it, then work for it. It's that simple. Let's begin with the video. Today, our topic is what all should you carry to lecture in first year MBBS? So, as I mentioned in my previous video, that you will be having 7 hours of college. In that 7 hours, 3 hours will be for theory, 1 hour anatomy, 1 hour physiology, and 1 hour biochemistry every day. And after that, you will be having 2 hours of practical. This will be having like 2 days anatomy, 2 days physiology, and 2 days biochemistry. Then post lunch we'll be having dissection. This is what we had. Depending upon the college, sometimes dissection is during the morning hours also. And on Saturdays we had seminars. So what all you should carry? Let's begin with pencil bag. You should have a pencil bag because you are going to carry a lot of things. So many colors, pencil, pen, colorful pens, sticky notes, marker, glue, and many more. Why colors is because you will listen me saying anatomy is all about diagrams. In most of the video, whenever I talk about anatomy, I mention that anatomy is all about diagrams. And in diagram, there are something which are color coded. For example, if you are drawing an artery, it should be drawn in red color. If it is a nerve, then yellow color. If it is a lymphatic channel, then it is green. If it is vein, then it's blue. I'll make a video and I'll explain you how to make your diagrams more nice and how can you get more marks. Then coming to a scale, you should have a pair of scale because in your upcoming physiology lectures in practical, they will teach you how to measure JVP, jugular venous pulse. And in jugular venous pulse, you need two scales. Then we have something called sticky notes. Some of the students do like to use it. It's very useful. For example, during a particular lecture, the professor tells you that this particular question is going to appear as 5 marker in university or as a 10 marker in university, or this is the topic from which we like to pick a viva question or pick a MCQ. So all that things, if you are clever enough, then you will write it in your sticky notes and you will stick that on your notebook on that particular topic. Then comes a marker. Then we have something like glue, sellotape, and stapler. Why we need this? Because sometimes this becomes a life savior, and also you will be the hero of that day because nobody bring such thing, and you will be the one helping everybody. So it's good to have this. It's not necessary. Uh, So to talk about textbook, is it compulsory? No. Some of the teachers may say you that you should bring, otherwise textbook are not compulsory. But some of the students do like to read in their leisure time. So for them, I'll suggest that you use the hit and trial method. Bring any textbook and see whether you are able to read that. Are you getting time to read that? Most of the time you make it. And if it is helpful, then go ahead with it. And if it is not helpful, you are just carrying it and carrying it back again to the hostel, then you can reconsider it. Otherwise, most of the time students like to have their anatomy textbook with them because it's lighter, and anatomy is a subject which most of the students find like they should read more and more, and it helps them also. Also, one thing I would like to suggest that do not read your textbook when the professor is teaching. Some of the students do like to do that. It's a personal choice. You may write whatever the professor is saying in your textbook itself, but you can do one alternative thing. It's just uh, advice. You can take it like you just listen what the professor is telling. Try to take some notes. Write all the important things, whatever they are saying, and after the professor leaves, open your textbook. Mark all the important question whichever the professor has stressed more. Write above the topic only 5M or 10M for 5 marker, 10 marker. Because the professor always stressed like this is the topic from where 5 marker is more probably to be appear in your university exam, or these are the topics from where we try to take MCQs, or these are the topics from where Viva questions arises. So they will tell you in between only, in between the lectures. So in this time, you can use your sticky notes or you can write on your book only with colorful pens as 5M, 10M, Viva, MCQ. And this will be very helpful when you read your textbook again. You will know which are the topics to be stressed more for your exams. Let's talk about notebooks. If you are a person who likes to take notes, then you should carry three notebooks. This is what I suggest. But if you feel that three notebooks will be very heavy and it will be tough to maintain, then you can get one thick notebook and divide it into three parts for anatomy, physiology, and biochemistry, and start taking notes. And you should always try to listen what the professor is saying apart from that topic. For example, which I mentioned earlier also, uh, in every lecture, in every topic, they will tell you why this topic is important, what is the clinical significance of this topic, how this topic is going to help you in your future, or how this topic appears in your exams, what are the type of the questions which can appear from this topic. These all things, if you make a habit of noting it down, then it will be very useful for you, not only for your exams, but for your later part also, because whenever you will go for your postings and when you come back to your first year subjects and you turn the notes, you will know that what is the clinical significance of this topic, so that you can correlate it with your postings, what you are learning there. Then after the 3 hours of theory lectures, as I mentioned, you will be having 2 hours of practical. So there is something called practical record and logbooks. This is something which the college will provide you, or you have to buy uh, from the college itself, because the logo and all will be there. In CBME curriculum, competency based medical education, this is a very important thing that you maintain your logbook and record, as this carries marks. So this is one thing. Also, this is a pass for you to enter the lab. If you don't have record or logbook, you will not be allowed to enter. So it is a good practice that you carry your logbook and record every day. If today, for example, today you are having anatomy, then carry anatomy record and logbook. If you have physiology, then carry physiology record and logbook. Likewise. Then we have something apart from books, textbooks, and pencils. Water bottle. You should be hydrated. You should drink plenty of water. That is one reason why you should have water bottle. Second reason, none of your friend is going to drink bottles, so you'll be helping them. Third reason, you never know when an emergency situations come. So it will be very helpful if you are having water. And additional to it, it is a good practice to carry some chocolates. It is also helpful in some emergency situation. So this is the list which I gave you. Well, there is irony here that you will see your seniors or your batchmates carrying just a textbook and a pen, the same textbook throughout the year. So I'm not telling that this is a must. I'm telling this is something which you should consider to have. Anyway, this is a personal choice. But what I want to stress upon again is about notes taking during the lectures, because the professor will tell you how to present an answer. Reading is a different thing, and presenting that particular knowledge in your exams is a completely different thing. During your lecture, the professor will tell you that you should write this particular question in under these headings, under these subheadings, and you will know which diagram to put at what heading, under what subheading, and something like that. So that is a very important thing, especially in anatomy. So it's all about presentation skill. If you have written one paragraph and someone has written the same paragraph in points, you may get 3 out of 5 and that person will get 4 or 4.5. So the differences is because of the presentation, how you present your answers. And especially in anatomy, if someone has drawn just a diagram and someone has written 2 pages about it, the person who has drawn only diagram may get more marks from that person who has drawn who has just written the answer. And if you can combine both of it, diagram with some points, you don't have to fill pages in MBBS. You just have to write what they have asked. The questions are very direct. You just have to answer those questions. Put the diagrams whenever necessary. Make a flow chart. For example, in physiology, flow charts are very important. Diagrams are very important in anatomy. Cycles are very important in biochemistry. So we'll bring a different video. We'll talk about how to present the answers in exam. Till then, we'll get back to you soon. Let's end with this quote. If it's your dream, you are the person who need to work. Obvious, isn't it? Thank you.